practitioner at Fireland Center for Coordinated Care. Thanks for joining us for this pocket program on vitamin D deficiency. So vitamin D plays several roles in our body systems, mainly musculoskeletal health, the strength of our bones and our muscles, but it also plays a lot of roles in our immunity. It helps to defend against organisms, and it helps to promote wound healing. And not only does that, but it plays a lot of role in our mood, as well as cardiovascular health. It helps with blood pressure regulation, and it can even prevent some cancers. Some signs and symptoms of vitamin D deficiency include bone pain, muscle cramps and weakness, as well as fatigue, depressed mood, and even decreased immunity. So if you find yourself feeling very sick often, may be a symptom of vitamin D deficiency. Those that are higher risk for vitamin D deficiency are those that live in climates where sun is limited in the winter, such as here in Ohio. Also those that are elderly, as well as obese individuals. And there's some certain medical issues that also affect our ability to absorb and use vitamin D efficiently, most notably Crohn's disease and celiac, as well as liver and kidney diseases, and even those that have weight loss surgery. The optimal intake for vitamin D on a daily basis is the recommended daily allowance. For an average adult, the recommended daily allowance is 600 IUs, or international units. Infants need a little less, about 400 IUs daily, and elderly need a little more, about 800 IUs daily. This is actually difficult to achieve by food alone. Vitamin D doesn't occur naturally in a lot of food sources. Some of these sources include tuna, cod liver oil, salmon, as well as liver and egg yolks. This is why a lot of times you'll see vitamin D fortified foods such as your cereals, milks, yogurt, cheeses, and even orange juice. The best way to know if you have a vitamin D deficiency is to have your blood checked. This is something your physician can order, or we actually have a community outreach program where we offer this without a doctor's order, without insurance, and it's a flat $35 fee offered once a month. You can find our schedule of those events on our website. So there's differing opinions in literature about the recommended value that should be in the blood. Generally, most favor levels between 20 to 40 nanograms per milliliter, which is how we measure vitamin D here at Firelands. If you and your physician decide that supplementation is needed as you're not at optimal levels, you can increase your daily intake of vitamin D sources in your food. You can also get increased exposure to sunlight, usually approximately 15 minutes per day, 2 to 3 times a week is generally sufficient. Of course, we need to balance this with your skin cancer risk. And of course, if supplementation is needed, vitamin D3 is most common, and it's available over the counter. So a few tips as we round out this pocket program. Vitamin D is best absorbed with a large meal, or at least taken with a fat-containing snack, as it is a fat-soluble vitamin. Also, if you take a calcium supplement, be sure to pair it with your vitamin D, as they work very well together. And I will caution, as vitamin D can become toxic if taken in excessive amounts. So, of course, be sure to speak with your provider, determine if supplementation is needed and in what amount to reach goals for you. Thank you so much for watching this pocket program. I hope it was helpful. Have a great day.